So this is a National Association of Peer Supporters presentation, and this is effective supervision for mental health peer specialists. My name is Christina Carney. Why are we not? There we go. So my name is Christina Carney. My pronouns are she and her. As I mentioned, I am from New York State, Syracuse, New York to be specific. And before coming to Texas in 2012, I worked for Vera House in Syracuse as a victim advocate, working with survivors of domestic and sexual violence. I was there for 10 years before making my way across the country to Texas in 2012. In 2014, I became a mental health peer specialist. So I have been in the field for 10 years now, and currently am the training and curriculum design manager for Via Hope, based in Austin, Texas. And we are a nonprofit. We provide certification training and continuing education training for peer specialists nationally and now internationally. We've started with Uruguay, working with them on reentry, which is really exciting. We also provide technical assistance for organizational change work. I included a picture of my puppies. I sometimes put a picture of myself, but you can see me. I'm here. And now you get the benefit of seeing the dogs as well. That is Chico, Lala, and Frida. Somehow managed to line up by size, and they are the best. I love them to pieces. All right, so I really wanted to start with just kind of like a overview, right? Best practices for supervision for anyone providing direct services. There's a lot of emphasis when people are supervising peer specialists, but really there's some things that we would want to consider for anyone who's doing this kind of work and kind of direct service work, which can be at times taxing and challenging, and of course, very rewarding. But there are some specific things that I think are really helpful to consider. So one, relationship before task. This is something we talk about a lot in peer support. Spending some time checking in, making space for what comes up. But we want to be able to do this without pathologizing or becoming paternalistic. So we're really trying to find a balance here between sharing and having boundaries. And I'll provide an example. Someone I supervise lost her son just a little over a year ago. And I will, in the beginning of our supervisions, check in. I will not ask her specifically about the things. In the beginning, I just, how are you? Are you okay? Is there anything you want to talk about? So I just make that space, because understanding that something that significant in someone's life will have an impact on how they're showing up for work, right? And how it might impact their work. So I really I want to make space. And I find that sometimes it comes up, sometimes it doesn't, just depending. But we make a little time for that so that we can acknowledge that, and I can provide at least some validation and any kind of support that might be needed on how it might be impacting her work. Something else that can come up for people is getting activated during their work, right? Those things happen when you're doing direct service, and again, can happen to anyone. So what does it mean, right? How do we take care of ourselves when it's happening? How do we take care of ourselves after it's happening? How do we learn from that? So these are just a couple of examples of ways where, or reasons, or that we would want to make some space for what might come up for people. We, again, it's not a therapy session. We're not trying to turn it into a therapy session, but it would be kind of absurd, really, to think that people aren't experiencing things that aren't coming into to their work from time to time, or that they're not being impacted by the work that they're doing. Something else we want to consider is prioritizing professional self-care. So having boundaries, making sure people are taking their breaks and their lunch, having a reasonable workload, beginning the day and ending it on time. And then, of course, working overtime should be an exception, not a rule. And again, that's good professional self-care for everyone. Encouraging professional development is something else that is, I think, really important. Supporting dignity of risk as a professional. So, dignity of risk is something we talk about in particularly in mental health peer support, but in the field in general. Um, a lot of times people worry that people who've had lived experience with, substances or mental health may not be able to take the risks. If they do, what happens? Maybe they'll have a return to use, or maybe they will have a recurrence of their symptoms. And it's really unfair to think that peer specialists or anyone doing direct service shouldn't also be able to, um, you know, partake in dignity of risk, right? Like that is something, that's how we grow. That's how we grow as individuals and professionals. So professional development, what does that look like? What are your ideas? I'm going to pause here. I'm going to stop my share for a second, and I'm going to invite folks. What are some things that you've come across around professional development that you think are that you want to put out there? I mean, conferences is always a great one, right? But what else is out there that you're familiar with? You can
think
feel free. Yeah.
I
Go
think
ahead,
getting
Christina.
them involved in like community boards and different you know, whatever councils or whatever is very important because then they get their name out there and they can see what's going on outside in the community. That's very important because they're serving the community. So why not build that connection, while they're working, and use that as their professional development. And also, you know, making sure that during supervision you're talking about what they want, what are their goals, what are their hopes, what are their dreams, what are they looking to do to better themselves moving forward. And I mean there's so many opportunities out there that they can get involved in.
I love it, Christina. And I love, so yeah, so committees, anything where they can be out in the community and making those connections. And I love that you're talking about also making space and supervision for that, right? Like, where do you want to grow? What are you interested in? Passing along those ideas, but also hearing from them, what they want to do, how they'd like to grow. Thank you, Christina. Sandra.
Always forget that I'm muted. Um, I was just going to say, I'd like also to connect them to whatever supports are available through like our credentialing body that we have from New York State. If there's any place that they can get support and start networking with. There's like a advisory board that people can get involved with for family peer advocates and other things. So I do like to kind of connect them to other resources so they're part of a community
Mm,
as much as they can, because that's going to help them also learn what else is out there in
yeah.
terms of support and opportunities.
That's great, Sandra. Absolutely. And I also I feel like it's so wonderful. So at Via Hope, we offer several continuing education trainings that are specifically designed for peer specialists. And they're created by people with lived experience and peer specialists. And for me, I think, being able to connect people into, if you're supervising peer specialists, being able to plug them into that peer specialist community professionally is so important as well. So it doesn't always have to look like that, but I think it is an important, really important component of that. Those are fantastic, y'all. Thank you so much. And also feel free if anyone is like, "Oh, my microphone isn't working," or "I'm just not comfortable sharing vocally," feel free to use the chat box as well. But those y'all both just covered some great stuff. All right, let's continue with this. So, modeling, do as I do, not as I say. We often talk about this, right? Do as I say, not as I do. But the reality is that if you are a supervisor, you are modeling, and people are looking at what you do more than what you say. So you can say, please take care of yourself, have good boundaries, etc. But if you are not actually doing those things, people will feel that pressure to do the same, regardless of what you tell them. So, really important that you're attending to your own professional wellness, so that the people that you are supervising can see that as well. can see what that looks like in action, right? And then finally, advocating for fair wages. This is a part of sustainability. This is for everyone. For yourself, for the people you're supervising. People in direct services don't make nearly enough money, right? They don't make the money that they should be making for doing the work that they're doing. So we want to really advocate for fair wages as a part of just good supervision and ensuring that we can hang on to folks. The reason so many peer specialists don't last as long as they would like or we would like in the field really is related mostly to low wages, because if you can't make a living off of working a full-time job and you've got to pick up other work, or you've got to find other work, you've got to find another job because you've got to be able to pay your bills. So this is a really important thing for the field. All right, so these were just considerations, again, for supervising anyone providing direct service. But let's shift our focus now and talk about, there we go. Nope, I went one too far. There we go. Talk about specifically some things for peer specialists. So these core competencies are from SAMHSA, Substance Abuse and Mental Health Services Administration. And so they are recovery oriented. Recovery oriented means that we understand that anyone and everyone can find their way to and through recovery and healing, however they may define it, but it is for everyone. Being person-centered, which means that we are really supporting self-determination at the end of the day, right? We're ensuring that the person is driving their treatment, their recovery, the way that services are being provided to them, what services they want to engage in. That's being person-centered, ensuring that we're hearing their voice. Voluntary. So it's so important that peer support is always voluntary. It should never be a mandated service, ever. We want to provide, this is about mutuality and providing as much as possible a relationship that's based in equal power. And you definitely can't do that if your services are being mandated. Being relationship focused. This is everything, leaning into relationship. Ideally, tasks that happen, they come from organically from the relationship. Now, obviously, some folks are working more in crisis settings, or someone may come in and say, like, I don't care about getting to know you. I have needs that need to get met, and that's what I need to talk about. Then that's what the peer specialist is going to do. They're going to take their lead. But we really want, in all ways possible, to be able to lean into relationship. And then, of course, being trauma informed. And I know everybody knows what trauma informed means. Does anybody have any questions about these core competencies from SAMHSA, these principles of peer support? Fantastic. All right. So let's talk about impact. So what happens if your organization isn't utilizing the core competencies outlined for peer specialists? So for example, what if your organization isn't being recovery oriented, person-centered, or trauma informed? Right? What is the impact on peer specialists? What is the impact on you or other employees? What is the impact on people served? What happens if you're working in a mental health organization that isn't prioritizing wellness for its employees? Right? And this can come in a few different ways, in a couple different ways. So what are the external messages of wellness at your organization? And those come through policies around sick days or other types of leave, and ADA, the American with Disabilities Act. So those are the external messages. And then the unspoken messages. So this shows up in what we're praised for at work. Are people being praised for never taking a day off? Are they being praised for, going the extra mile by working through, the evening or weekends, right? The side conversations we have about our weekends, or the kind of wellness or recovery language that's being used in general. And then expectations that are verbalized but not official. So we would never tell you that you need to work till 7, but the expectation is really that you're going to stay until your work gets done. Right. So, all of these things, again, like what is the impact on peer specialists? What is the impact on you or other employees? And what is the impact on people served? Because these things do matter. Sandra, yes, people will leave the organization, but in the meantime, they'll probably burn out, right? Because that's, you know, I mean, we can have a range, right? Like we could say like, oh, it's not, maybe always the most supportive environment to all the way to this is a toxic environment that expects too much from its employees and isn't compensating them properly and isn't, et cetera. And so, yeah, eventually you will see that you will see a high turnover rate. Sandra, go ahead.
Yeah, I just wanted to share my own experience with this because so I'm a family peer advocate. I'm actually going for my adult peer as well, but right, I was like one of the few family peer advocates got elevated to supervisor, and it was kind of that situation where all of a sudden, no, you're part of management and you have to like put in all these hours, and the VP is doing all this pressure, and it really moved, part of my wheelhouse as a peer and as a supervisor was to make sure people do self-care and make sure that they're not burning out and doing that mental health piece that I had taught myself and learned along the way. And that's why I was a good supervisor, if I say so myself. However, when you start to have an organization that's not fostering that or allowing you to do that yourself
Mm.
because of these unspoken messages and spoken messages, because of the added pressure, you can't even, sorry, that's my ring. Um, you can't even do that and foster it in your own people. And it was like what made them want to elevate me and put me to a certain spot. When I got to that level, they couldn't support that. They couldn't go the next level to allow me to support my staff in that way. And that was the beginning of the end. And eventually I left that agency. So it was like a great idea, but then in reality, they weren't putting any supports in place that would allow me to leave that space for my staff to be able to do that for themselves.
Yeah, yeah. That is too bad.
Yeah, it
Um,
was.
yeah, thank you for sharing your
Sure.
experience
Thank you
around
for
that.
listening.
Yeah, absolutely. Absolutely. It's really frustrating, right?
Mhm.
Because you see it so clearly, you know it for yourself, and then you can advocate for yourself, but then yeah, then you got to advocate for your people. And if the response is one of like, well, we can't,
Or we won't.
yeah, or we won't, then what? Yeah.
Yeah.
Yeah, it's so
So it's
hard.
unfortunate.
I find it's interesting too, I've done nonprofit work for a very long time and you know, been both in direct services and supporting direct service folks. And I find that sometimes I'm a little disappointed. I'm a little disappointed, and I want our organizations to do better. I want to say like, hey, like you've got to model, you've got to really embody the work that you're doing in for everyone.
Exactly.
This is because if you can't provide it for employees, if you can't provide it internally, do you really think you can provide it externally to the people you're supporting? And I don't
Right.
think that you can in the way that you want that people really want to. Yeah. Christina, did you have something you wanted to share? Go ahead. Yeah.
I think that it also goes to the agency or organization's readiness to even bring these individuals on board.
Mm.
Because, and I also think that it's very, very important that peers support peers because you have that knowledge, you walk the walk, you can talk the talk, you can provide the supports that are needed, and clinicians have their space and place, but they should not be overseeing peers at all. I don't feel that at all. And it also goes to the lack of respect that, especially with, because I work in the children's system, so it's a little different because, you know, our work is a little different, especially with parent advocates. But the youth advocates, they are, you know what I'm saying? They have to be respected. They have to be welcomed in the space that they are working with, because they are the ones that have received these services and they are the experts. You know what I'm saying? On this field. And we are the experts. If you're going to ask me to utilize my lived experience, you need to pay me for that, number one. And you need to respect the fact that I'm the expert and stay in your own lane, because I don't provide therapy and don't try and don't want to. But you should respect the fact that I bring my own expertise to the table.
Yeah. Yeah, absolutely. Here. I feel like I'm gonna go ahead and do a little clapping. There we go. And Amali says in the chat box, I have supports in place, but the organization doesn't really recognize the real issues. Yes, they need to do better. My organization has both peer with peers, but also they are supervised by clinicians. This happens quite a bit. And I think especially, you know, people just get worried, feel like they can't leave peer specialists, you know, alone. Got to have a clinician in there. I'll tell a brief story. When I worked at Austin State Hospital for 3 years when I started in the field, so inpatient psychiatric hospital. And because I came from this trauma background, I was like, I want to start a women's survivors support group, peer support group, you know. And everybody just about lost their minds. They were like, you can't do that. We can't talk. Nobody can talk about trauma. Nobody wants you to talk about trauma. And I was like, well, actually, people talk about it when they need to talk about it. And like, you know, I spent a good year advocating to get this group, but my last sort of battle was that they wanted a clinician in the room. And I said, the only way we'll have a clinician in the room is if they openly identify as having lived experience as a trauma survivor, and that they are willing to identify, you know, openly say that. And so that squashed that. Thankfully, I had some great allies. And, you know, I have a great deal of respect for the work that clinicians do. It's not that piece. It's that we don't need to be babysat at the end of the day. So, um, so yeah, so right, yeah. So super important that there's you know, that the support is appropriate, and that, yeah, we're all kind of staying in our lane. So again, I really value and appreciate the work that clinicians do, and I do you know, I do know that clinicians, do we have any clinicians here? I don't want to like, oh, I don't know if we have any folks in here who are supervising peer specialists. It doesn't mean you can't supervise peer specialists effectively, but there are things to be aware of. And let's continue on with that, with the slides here. All right. So the kind of the beginning and the end of this, like what happens if, is like we really just need to be aware of organizational culture and its impact. Every organization has a culture, right? So we want to be aware of it and how it's impacting us, peer specialists, other employees, and, you know, even the people served. Let's talk about the peer support role. So again, we're kind of narrowing our focus. So we started broad, and we're bringing it in, dialing it in, as it were. So let's talk about the peer support role. So having a full understanding of the role of your peer specialist is absolutely essential to being able to provide supervision. These tasks that I'm going to talk about should be done using the core competencies from SAMHSA as a framework, along with ensuring that they're coming from a place of mutuality and transparency and supporting self-determination. So all of these things I've mentioned. I don't think I've talked about transparency. That's one of my favorite ones. And I think one of the things that really drew me to this field to begin with, right? So we're always coming from this place of authenticity and as much as possible with shared power. So what are these tasks? What is a peer support role? So here are some things that peer specialists do. So relationship building and cultivating connection. I had a supervisor who told me, if it looks like you're just hanging out, you're doing your job. Right? You're building relationship. That takes time, building that rapport, connecting, building trust. All of that takes time and can sometimes look like you're just hanging out with a friend. You might be talking about all kinds of different things. Some of them may be related to recovery or wellness, and some of them may be a little tangential, and they may come back around to that. So if you're someone who's not as familiar with the peer support role, you may not understand when you see people just talking. I used to bring games, pull out games. I'd bring coloring stuff, and I would go on a unit and I would pull out the stuff and I would just start coloring, and I would invite people to join me, or I would have a game out and I'd be like, anybody want to play Connect Four? Anybody want to play a game of Uno? So those kinds of things, those are the ways that we can start to build connection. So if it looks like your peer specialist is just hanging out with someone, consider that what they're doing is that they're building relationship. Sharing lived experience through snippets and illustrations. So this is an expectation. This is part of what makes peer support, is that we are sharing that lived experience through, the different, you know, we say snippets or illustrations. Usually you don't share your full story, right? So you're sharing little bits and pieces as it seems appropriate. I also like to remind folks, though, that, a peer specialist isn't obligated to share every single piece of their story. So there are things that, and since I'm a mental health peer specialist, I'll just use myself as kind of an example here. So there are things maybe that I'm working through and I'm not ready to share. Maybe it's a little messy for me and I'm still trying to figure that out, and I'm not ready to put it out to the world yet. Or maybe there's some things that I just, I still feel tender about, that feel very close to me and very private. So I'm never obligated. Maybe there's something that activates me, like, hey, like I can share so many things, but there's a couple of areas that I still get a little activated around, and I want to be able to have boundaries around that. So it's important to be able to support your peer specialist and knowing when it's appropriate to share lived experience. It's not always appropriate, both for themselves and for the person they're supporting, right? I don't want to just jump into, well, let me tell you about myself, because they may not want to hear it at this moment. So supporting your peer specialist and navigating that is important, but this is a part of the role. Something else peer specialists do, a huge task, is advocating with and sometimes for. We always want to start with, again, shared power. But this can look like accompanying people to different types of appointments, learning how to utilize transportation. So taking somebody, going with them on the bus, subway, what have you, filling up forms together, doing role plays, and of course, much more. Something else that peer specialists can do is facilitate peer support groups. And then, of course, supporting wellness or recovery pathway of choice. So we always want to support, again, we're all about being person-centered, right? Supporting self-determination. So what is your pathway of choice? And we may have to work with someone to figure that out. But these are sort of, these are the core pieces. These are the core tasks of the peer support role. So we want to be able to, again, really understand these things to be able to provide good supervision around them and understand what our peer specialists are doing. We should also ensure that the actual job description aligns with peer support competencies and principles and isn't asking peer specialists to do anything outside of their role. So that's something else to think about as well. So yeah, Christina says, I think it should be mandatory that they take the same trainings peers take before bringing peers into the workspace. Well, there should be some orientation for peer specialists. I don't know. I'm not always, I like to keep myself, I like to have peer specialists being in spaces that are just for peer specialists. It can feel a little different when you have folks who don't have lived experience coming into trainings, but I do think providing trainings for an organization, we have something called demystifying peer support. And so we provide a lot of information and clarity around, peer support, what the role entails, and so on. So Kimberly is asking, what is a peer support group? I'm newer to the peer support role. Great question, Kimberly. So, a peer support group can look like a lot of different things, but it is a group, right, where folks are providing peer support in that group setting. So I know that sounds like a little simplified, but it really can look like anything. So I have done groups where I open up for a topic. So maybe we're going to talk about, a particular tool, so maybe we're going to talk about meditation and how it's helped me. So I might use a snippet to be like, hey, something I do is I do yoga and it really helps me. What's something that helps you? Or we might go into a deeper dive onto a particular topic, or we might keep it open and conversational. You can present materials. So really just like any other group, except that it really should be coming from a place of shared power and building community. So I'm not here to teach you as a peer specialist. So peer groups should never be about like medication management or things along those lines. They should really be more focused on learning together as a group and building that community. So Kimberly, you're a peer and would like to learn more about demystifying peer support for myself and for the company. Yeah, absolutely. I don't know if, so I'm not as familiar with, I didn't learn about peer support until I came to Texas, strangely enough. So I'm not as familiar with what's offered, um, in New York, if you have some, anything there, but I'm happy to, I'll provide my email at the end and I'm happy to provide what resources we have here. Um, so I could definitely do that. So that's a peer support group. All right. So the Peer Support Code of Ethics. So the New York Peer Specialist Certification Board, NYP SCB, Code of Ethical Conduct. I'm going to share a link with you momentarily. So we're going to look at, there's some professional standards. Let me actually just stop my share again. And I will put this in the chat box. So I'm putting a link in the chat box. And I'm going to invite you to go ahead and open that up and take a look. I'm just going to invite you to take a couple minutes just with that top part there. Let me pull it back up for myself so I have it. So I was just in here earlier. Let me scroll back up. So move past it. So the professional standards, you'll see there are rules there. So I'm just going to invite you to take like 2 minutes to just kind of take a look at these. All right. I have looked at a number of different states' code of ethics for peer specialists, and they pretty much, I think, like most professions, they look the same across the board. Um, but I don't know, was there anything that stood out to anyone in here, or anything that you had a question about? Pretty much, pretty straightforward, right, Christina?
Yeah, they're pretty much standard throughout the peer workforce, no matter what system you're basically like, even if you're working with, children and families, adult peers,
Yeah.
basically the same.
Does anybody have a favorite or one that like really you're like, oh, this is good. This is important. Not that they're not all important, but one that stands out to you more than the others. 6.2. So, a New York certified peer specialist shall not use a title, designation, credential, or license, firm name, letterhead, publication, term, title, or document which states or implies an ability, relationship, or qualification that does not exist and to which they are not entitled. Yeah, so that's under fraud-related misconduct. I one of the really great things about when you really get into ethics, and I encourage, all of you as supervisors, it's so important that you're familiar with this code of ethics, because this peer specialist, usually you have to sign, you have to renew every time you recertify, right? Like these, you could lose your certification if you are not, if you are violating this code of ethics. So important that we support, but also it's like really interesting conversations. One of the ones that I always point to, right, is it's this idea. So peer specialists shall not accept gifts of money or items of significant value from those whom they support in recovery and healing. And that kind of seems straightforward, but the idea of significant value can vary. So one thing that, like, when I was at Austin State Hospital, we were always getting people would like color, doodle, do little sketches, and they would give them to us. So we had a whole wall in our office of all the artwork that people gave us. So is that something of significant value? Well, what if someone's an artist and their sketches, their paintings, their drawings go for $300 when they sell them? Does it change? Does that now, like, that person gives me one of their sketches? So there's things to unpack, right? There's things to unpack in all of these. I do love also that every code of ethics I've seen, they do ask that peer specialists keep current with emerging knowledge relevant to supporting people in recovery and healing. And I also love that y'all include healing in your code of ethics quite a bit. Um, and that you openly share that knowledge. I think that's fantastic. I think it's fantastic. Um, Kimberly is saying 1.6. So yeah, so yes, the one I was just talking about. Sandra is saying codifying good boundaries. Yeah, yeah, yeah. So again, we're just doing, like, we're dipping a toe, right? We don't have enough time to really unpack all of these, but it is so important that you support, one, that you are familiar with these, and that two, you support the peer specialists that you are supervising with ensuring that they are familiar with these. I think it's easy to think of, ethics that's kind of dry, or maybe it's just black and white. It's just here, and I just have to, these are rules I have to follow, things I should do or not do. But when you start to unpack them, there's some really interesting conversations that you can be having. Like, well, what does that actually mean? Right? What does it actually mean? Um, let's find one that's like a good example. What does it mean to respect the rights and dignity of persons whom you're supporting in recovery and healing? What does that look like? What does it mean? Does it mean different things to different people? So these are really rich, juicy conversations that you can be having with your folks. So something I want you to take away with you today. I'm going to share my screen again here. There we go. So the link that I share with you also provides a complaint form and outlines disciplinary procedures. And I think I've gone on enough about how important it is for you to be familiar with it and to be able to support your peer specialists if especially if they're being asked to engage in any tasks that would conflict with their ethics. And this does happen. All right, let's talk about some obstacles that peer specialists face. So paternalism. What is paternalism? Paternalism is where we treat someone as though they are a child, or a patient, right? Like that they're kind of incapable of making decisions for themselves. It can show up in many ways, but we can understand it primarily as an expression of power. This often directly relates to how peer specialists are treated, but may be more pervasive in an organization. It can look like trying to fix, manage, or define someone's wellness or recovery. And it may also be reflected in how peer specialists are viewed. Are they seen as a professional, as an adult, or are they seen as a patient or a child? Right? This infantilizing or paternalistic kind of approach. And sometimes that happens like I've had doctors that were like, I know the things and you don't. And I'm like, you do, but also I live in my body. I'm the one who's in it every day. And so can we talk about that, please? Right? So, and it's easy also, I think, for folks to kind of defer to people in positions of authority, such as, someone who's a clinician or, a doctor, whatever language we want to use or whatever title we're referring to be like, well, you are the authority. But again, then, are we putting ourselves in that position of sort of being the patient or the child? I don't know. I don't know enough. You know better than me in all the things. So we really want to make sure that peer specialists are being, both perceiving themselves and that the organization is perceiving them as a professional who is adding to the organization and adding to the services provided. Something else, and I mentioned this earlier, but another obstacle peer specialists face, of course, is lack of fair wages. So if someone is having to work an additional job or find other work, it means that we just don't have the longevity in the field that we would like to have. So this is something else that, of course, peer specialists aren't just facing this, but it is something that is happening a lot for them. And then moral injury is something that comes up a lot. What is moral injury? So it's what happens when a person is asked to do something that is outside of the scope of their values and ethics. And this is something that peer specialists face quite a bit. I've heard everything from, peer specialists being asked to clean the bathrooms to provide transportation for people solely, right? Not as a part of like, hey, you want to go with or take someone somewhere, but right, like that people are just really getting kind of locked into answering phones. Again, things that are just outside of the scope of their work, but not just their work, their values and ethics. So this is something we want to be really mindful of as well. Peer specialists, a few other obstacles that peer specialists face, feeling like they're under a microscope. So it's that thing of if a peer specialist maybe has a bad day, is in a bad mood, people are like, oh no, are you taking your medication? Are you still on your recovery path? Right? Not just, oh, like you're having a bad day and that's okay. And which leads to, a lot of peer specialists may feel unable to share any struggles for fear that others will think they're no longer in recovery or maybe even lose their job. Peer specialists will personally feel the impact of any stigma present in their organization, whether it's named or unnamed. They also may feel the need to work more and harder so as not to be seen as sick or inferior. And feeling like their recovery pathway is devalued or invalid because it looks different. So, for example, something like harm reduction. And that's the tricky line to walk for peer specialists, is that it is professional, but our personal is part of our professional life. And so those things that feel hurtful as a professional often also hurt people personally as well. The last thing I want to share with y'all is it's around feedback. So I'd like to know, first, before I do that, I'd love to know, has anyone here experienced a time where they where they received feedback and it went well? Lamar, yeah.
Well, I just also want to touch on some of the other stuff, the that outside of the scope of the peer, and I do a whole lot of that, and I don't mind. I love it. To help out in other departments, right? Other departments, not the cleaning and all that other stuff, but can you do the front desk? Yeah, can you sit at the front desk? Okay, I have to leave early, and I do that. Also, can you reschedule somebody for intake? Can you do intake? So I learned how to do all of these things. I learned how to sit in the courtroom, and when the peer comes up and the judge has them a mandate alternative to incarceration, and then I learned how to, from the court op, how to take that person, intake them, assess them, and try to help them out to see what their needs are. So out of the scope is a lot. Even escorting someone to a rehab or detox, personally.
Yeah. I mean, that's great. It sounds like, Lamar, for you, that you found it really has enhanced your work, and that's fantastic. I think where it gets tricky is when peer specialists are asked to do things that at the end of the day kind of conflict with the role. So if, for example, anything that would put you in a position of power, a big one that comes up a lot is assessments, like an ANSA, Adult Needs and Strengths Assessment, right? That's a clinical tool that peer specialists should not be utilizing. And because it puts you in a position, right? One, you're using a clinical tool, period, right? Like that should be enough. But also it puts you in a position, we're always looking to minimize the power differential, right? We want as much power with as possible. So anything that puts peer specialists in a place where it amplifies power over is not good. It conflicts with our values, it conflicts with our ethics, it conflicts with the whole heart of the role and what we're there to do, the purpose of the role, right? So, the other thing I would ask is, right, are other employees and other roles also being asked to step in and help out at the front desk? Right? Are other folks also being asked to do those things? If there is a sort of sense of communal support and organizational support from all departments, that's fantastic. But if it's always the peer specialist that's like, hey, can you go over here? Hey, can you do this? Hey, can you do that? Like, at what point, where does the boundary need to be drawn, I guess is what I'm saying, right? So I think I love what you shared, Lamar, that you're having this great experience of kind of expanding your knowledge and your understanding. But like, at the same time, I would say, and at the same time, we want to make sure that we have boundaries around those things that would be inappropriate or take us outside of our role. It's always the peers. Yeah. So for me, that's a little concerning, right? If you're saying like, hey, like, yeah, we ask people to step in, but the only people we're asking to step in and fill in other places are the peer specialists, then I'm concerned about, how they're perceiving your role and the value they have for your role as a peer specialist. You're there to provide peer support. And while we can provide peer support in any number of ways, and it can look different at different times, right? I can offer you peer support anywhere, right? I can offer peer support at any time, but again, that's what you're there for. And so yeah, so I would have some concerns. Why only the peer specialists?
It's funny because you wouldn't ask the director to take out the garbage, but they'll ask the peers to do all sorts of things that are not in their scope of work. Um, and this has been going on for years. I mean, since I was first started in this, they're always disrespected, and I hear so much, um, from peer specialists and adult peers that they are called patients and all of these other things, and that they don't have to be, respected and all of that. That's ridiculous. They're adults. They add so much to this work. They bring so much to this work, and they deserve to be respected. And that's why I feel like sometimes you need to stand up for yourself and your principles. You don't have to be rude. You don't have to be, you know, um, you know, rowdy or anything like that. But you can stand up for yourself and say respectfully, that is not in within the scope of work, my
Yeah.
scope of work, or it's not something that I should really be doing. And I would prefer it if you ask somebody else, or maybe you should answer the phones. Or,
Right.
you know what I'm
Right.
saying? But
Yeah.
I'm just saying it's been something that's been ongoing for years, and it's just too much. And that's where you need to learn to advocate for yourself.
Absolutely, Christina. And since this is a supervisor training, I would also add, right, for people supervising peer specialists to be able to advocate as well. So the clear, again, kind of all circles back around to being clear on what the peer specialist role is. What is a role? What does peer support look like? Being clear and really understanding the core competencies, the values and principles, the ethics of the field, so that that's how you can offer both proper support to the person you're supervising, but also then advocate within the organization for them to really be able to stay true to their role and the reason that they're there. So super important. I'm noticing time. I just have this one slide, so I'm just going to kind of breeze through it a little bit. So feedback should really come from a genuine desire to see someone grow and be successful in their work. We want to provide feedback with honesty and kindness. We should be direct and specific. Generalized comments won't really help with a solution, right? Offer space to explore solutions, but also be prepared to make tangible suggestions. Staying open-minded and flexible in your thinking, so be willing to listen. Check in to see if this is the right time or place, and be willing to revisit if not for both you and the person you're supervising. So it's okay if a conversation can't happen now. Like, hey, like you just, it's Friday, 4:45. Maybe I don't want to talk about anything right now other than what I'm doing for my weekend. I'm tired, I'm worn out, I'm ready to move forward, not have like a deep conversation about something you need to provide feedback for or on. And then providing time during supervision for you to receive feedback and ask directly if there's anything that you can do to improve their supervision experience. It's important to cultivate a relationship where your peer specialist feels like they can actually give feedback, not just receive feedback. So I wanted to finish us up on that one. And I know I have one more slide in there with my email. There we go. So I wanted to provide you also with another recommended resource. So and that's my email there, christina.carney@viahope.org. But I wanted to, let me grab it real quick. This is the Supervision of Peer Specialists. It's from PeerTac. I thought it was a really great kind of a workbook. So y'all may be familiar with this, but I'm going to pop that in the chat box. So that is there for you. And let me put my email in here as well. Y'all, it's just flown by. What a wonderful conversation. Yeah, I can pass along well, actually, Casey has the slides. Casey, would you be able to provide folks with those?
Yes, I'd be happy to send those out.
Fantastic. Thank you. So yeah, thank you so much, everyone. I really enjoyed spending the last hour with you, and I hope you found this useful and helpful.